Every year, millions of seniors walk into a clinic or hospital for what they believe is a routine checkup. They're doing what they've always been told. Catching problems early, staying ahead of their health, doing the right thing. But what if I told you some of these very tests, the ones meant to protect you, could actually raise your risk of a stroke overnight? I know, it sounds hard to believe. You trust your doctor. You follow every recommendation. You do exactly what's advised. And yet, buried in the fine print of modern medicine are silent risks. Risks that almost no one talks about. Not the news, not the pamphlets in your waiting room, and sometimes, not even your doctor. Now picture this. You walk out of your annual checkup, feeling fine. Everything looks normal. And then, just a few days later, you're dizzy, your vision blurs. Maybe your speech feels strange, and you're left wondering, what just happened? Here's the truth. Certain diagnostic tests, especially when done too often or under the wrong health conditions, can quietly trigger sudden spikes in blood pressure, disruptions in blood flow. In some cases, a chain reaction that ends with a stroke. Now, before we go any further, this video is not here to scare you. It's here to inform you. So you can ask better questions! So you can protect yourself and your loved ones. Because after the age of 60, health is not just about catching problems early. It's also about avoiding the ones we might accidentally cause. In this video, we are going to uncover 5 of the most common medical tests that can carry hidden stroke risks, especially for seniors. And most importantly, I'll share exactly how to protect yourself before your next appointment. If you're over 60, type A1 in the comments. If not, type A0. And be sure to subscribe to WellthWise, where we uncover the truths that others won't tell you. Test number 1, CT scan with contrast. Let's start with one you may have had before. The CT scan with contrast. If you've had one, you probably remember that warm, flushed feeling moving through your body. That's the contrast eye doing its job, helping doctors see your blood vessels, organs, and tissues more clearly. Sounds helpful, right? And in many cases, it is. But here's what many seniors are never told. That little injection can do much more than just make a picture look clearer. It can quietly stress your cardiovascular system, especially if you reach over 60 and already dealing with high blood pressure, heart problems, or kidney issues sometimes. The dye triggers something called a vasovagal reaction, a sudden drop in both heart rate and blood pressure that can lead to dizziness, nausea, fainting, or even brief unconsciousness. In other cases, the opposite happens. Blood pressure spikes rapidly, and fragile blood vessels already narrowed with age can tighten or spasm. That's when the risk of a stroke or cardiac event starts to creep in. A study in the Journal of Vascular and Interventional Radiology found that older adults who had contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially if they had hypertension, cardiovascular disease, or kidney problems. Here's a real-life example. An 81-year-old man went in for a routine abdominal CT scan after some mild digestive discomfort. The scan came back clear. 2 days later, he suffered a minor stroke. The likely cause. That contrast injection may have spiked his blood pressure just enough to trigger a clot. Now, does that mean CT scans with contrast are bad? No. They save lives every day. They detect cancers, blood clots, aneurysms, things you don't want to miss. The key is using them wisely, not just because it's routine. So, what can you do before agreeing to a contrast CT? Ask your doctor. Is this scan essential? Can we do it without contrast? Is there another option? Like ultrasound? That S, safer for my age and condition? And always share your full health history. Blood pressure, kidney health, medications, any past reactions. Test number 2, the exercise stress test. Next, the stress test. It sounds proactive. Walk on a treadmill while hooked to a heart monitor. See how your heart performs under pressure? But for seniors, especially those with high blood pressure or existing heart conditions, this test can become risky. Why? Because the treadmill pushes your heart rate up, your blood pressure rises, and your cardiovascular system faces sudden, intense strain. For a healthy 30-year-old, that's fine. For a 70-year-old with vascular issues, it can be like lighting a match near dry grass. Risks include dangerous spikes in blood pressure, sudden arrhythmias, even small tears in delicate blood vessels in the brain. A 2020 study in the American Journal of Cardiology looked at over 1,300 patients above age 65. Nearly 7% experienced harmful events during the treadmill stress test, including abnormal rhythms and dangerous blood pressure surges. One of our WellthWise viewers, Margaret from Ohio, shared her story. She was 74, went in for a stress test just to check in. Halfway through, she felt dizzy and her chest tightened. They stopped the test. But the next day, she had a minor stroke. The takeaway: if you're not having symptoms, chest pain, shortness of breath, ask if the test is essential now or if it can wait. Sometimes, a nuclear stress test with medication or a resting echocardiogram is safer for seniors. Test number 3, sedated endoscopy or colonoscopy. After 60, many doctors recommend endoscopies to check the esophagus, stomach, or colon. But sedation changes blood pressure and circulation. And if you're on blood thinners, like warfarin, aspirin, or Plavix, that combination can raise your stroke risk. A 2021 review in gastrointestinal endoscopy found that patients over 65 had a higher rate of mini-strokes within 72 hours of sedated, and one 76-year-old woman went in for a routine colonoscopy. 2 days later, she slurred her speech and lost coordination. The drop in blood pressure during sedation, combined with her daily aspirin, may have created the perfect conditions for a clot to travel. Tip: always tell your doctor about every medication you take. Ask, do I need to stop my blood thinner? What are the sedation risks for someone like me? And can it be done without full sedation? Test number 4, MRI with gadolinium contrast. Mister is our powerful tools, but when contrast is added, usually containing gadolinium, seniors with slower kidney function may struggle to clear it. Gadolinium can linger in the body and has been linked to nephrogenic systemic fibrosis, a condition that hardens skin and connective tissue. It's also been found in brain tissue, with possible links to confusion and balance problems. A 2019 study in radiology tracked over 2,000 patients over 65. Within a week of contrast, Mr. is about 5% reported stroke-like symptoms, especially those with undiagnosed kidney issues. Before contrast, Mr. I asked for a GFR blood test to check kidney function. If possible, request the scan without contrast. Test number 5, routine carotid artery ultrasound. Finally, the carotid artery ultrasound. It's painless, quick, and non-invasive. But here's the catch: you don't have symptoms. Dizziness, vision changes, weakness, finding narrowing may lead you to surgery you never actually needed. A study in the New England Journal of Medicine found that for seniors with moderate narrowing but no symptoms, surgery didn't significantly lower stroke risk compared to medication and lifestyle changes. In some cases, the surgery itself caused strokes. Before agreeing to a carotid ultrasound, ask, what are we looking for? If you find narrowing, what happens next? Sometimes, the safest move is simply monitoring. Closing! Empowerment. So, here's the bottom line. Not every test is bad, but not every test is necessary. After 60, your body responds differently. What's routine for one person might be risky for you. Always pause. Ask questions. And remember, your health is a partnership not a checklist. If this helped you feel more in control, drop a 1 in the comments. If not, type 0. And don't forget to subscribe to WellthWise, where your health is guided by knowledge, not habit.